Hello and welcome to this quick review of the dental nomenclature. And this is for either those of you who are not familiar with how the teeth are numbered or named, or for those of you who have seen this information in the past, but it's always good to have a review so that we're all in the same page when it comes to discussing our findings in the patient's mouth. So let's get started. So obviously there's more to the teeth that what we can see. We have root systems and there's bone and gums, but right now we're just going to focus on the part of the tooth that we typically chart on the patient's record, and that would be the dental arches. So we have an upper and a lower arch, and we have this imaginary line that crosses the middle, and that's called the midline. And this midline divides the mouth into right and left, and that would be the patient's right, not the operator's right. So it's right and left, and also it divides the mouth into four sections that we actually call quadrants. So we have the upper right quadrant, the upper left quadrant, the lower right quadrant, and the lower left quadrant, and those are the four quadrants of the mouth. When we talk about adult dentition or permanent dentition, we know that we have different kinds of teeth that we call them by different names. In the case of the front teeth, we have incisors. We have 4 upper and 4 lower incisors. We have 2 upper canines and 2 lower canines. We have 2 sets of bicuspid, 4 upper and 4 lowers. And we have 6 upper and 6 lower molars for a grand total of 32 teeth. Since some of those teeth we have more than just one set, then we differentiate them further by naming them depending on their location. For example, the central incisors are right next to the midline. And then we have the lateral incisors, which means they're on the side of the central incisors. Then we have your canines, which are also called cuspids, or they also are known as eye teeth, or colloquially known as fangs because they're pointy. After that, we have the first set of bicuspids or premolars, and they're called bicuspids because they have 2 cusps each. And we have a second set after that, which is the second bicuspid or premolar. We then have 3 sets of molars, and we start with the first molar, which is our 6-year-old molar. It's the first molar to show up in your mouth when you're 6 years old. After that, we get another set of molars when you're 12 years old, and that will be the second molars. And we have 4 of those. And last but not least, when you're about 18 years old, you get your third molars, also known as wisdom teeth. We can further say what kind of tooth it is depending on the location in the mouth. So we call the front teeth anterior teeth because anterior means front, and that includes the incisors and the canines. The rest of the teeth that are in the back, we call them posterior teeth because posterior means back, and that includes the bicuspids and the molars. Now, when it comes to numbering individual teeth, the numbering system that we use starts on the upper right last molar, upper right wisdom tooth, and starts with number 1, and we sequentially number the teeth on a clockwise direction. That's number 2, then we continue with number 3, and so on until we reach the other end of the arch at tooth number 16, which would be the upper left third molar or wisdom tooth. And then we continue on the lower left arch with the third molar or wisdom tooth, and we continue on a clockwise direction, numbering the teeth until we reach the other end of the arch with the last molar, which would be the lower right wisdom tooth or tooth number 32. Now, on the baby teeth or primary dentition, there is a couple of differences. Baby teeth only have 20 teeth, and just like the permanent teeth, we have central incisors, we have lateral incisors, we have the canines, and the molars, we have first molars and second molars. Now, as far as the numbering for baby teeth, it works a little different. We don't use numbers. We actually use letters. But we start also on the upper right last molar, on the second deciduous or baby molar, and that would be tooth A, and we go on a clockwise direction all the way till the end of the arch to the upper left last molar, which would be tooth J. And we continue on the lower left last molar with tooth K, which is the second lower left molar, on a clockwise direction until we reach the other end of the arch with tooth T, which would be the lower right second molar. Now we're going to talk a little bit about the surfaces of the teeth, and this is important because this is how we know or how we describe the findings on each individual tooth. Now, that's how we know where the cavity or how big the cavity is, or what surfaces of the tooth have been affected. So on this diagram, if you remember, we have a midline, and the surface of the tooth that would be pointing towards the midline, we're going to call that the mesial surface. That is called the mesial surface because mesial means middle. So the surface of the tooth that looks towards the middle is the mesial surface. The next surface will be the opposite, is the surface that is looking away from the middle, or that is towards the back of the mouth. And we call that the distal surface because distal means distant or farther. Then after that, this surface that you see highlighted in blue on the back or the posterior teeth is the occlusal surface. And the occlusal surface is called like that because occlude means to close. And that is the surface that closes against the other tooth. On the front teeth, we don't have an occlusal surface, but we have a cutting or incisal edge, or we call this the incisal surface. And that is called like that because incide means to cut. And those are the teeth that we use to cut our food. Now, the next surface is the inner surface, and this is the surface that is in contact with the tongue. It is called the lingual surface because lingua is a Latin root that means tongue. So that is the surface that touches the tongue. And the last surface, which would be the outside surface on the back teeth, on the posterior teeth, we call that the buccal surface. And bucca also comes from mouth, from the Latin mouth. And on the back teeth, that is the surface that is in contact with the cheek. But on the front teeth, the same surface, we call it the facial surface. And that is the surface that is in contact with the lips. So if we have a molar, we now know that the biting surface is called the occlusal surface, and we're going to chart that as an O for occlusal. We know that's the occlusal surface, and we're going to chart it as an O for occlusal. Since we know the midline would be on the left side, then that surface highlighted in green, that would be the mesial surface, and it's charted as an M for mesial. The surface that is in the back of the mouth or pointing towards the back of the mouth is the distal surface, and we chart it as a D for distal. Then the inner surface that is in contact with the tongue is the lingual surface. We chart it as an L for lingual. And the last surface, or since this is a back tooth, we call it a buccal surface, and we chart it as a B for buccal. If this was a front tooth, then you know it works a little different because we don't have an occlusal surface, but we have an edge that we call the incisal edge. The surface that looks towards the midline, we still call it mesial. The surface that looks away from the midline, we call it the distal surface. The inner surface would be the same. That would be the surface that's in contact with the tongue, is the lingual or L surface. And the last surface would be, since this is a front tooth, we call it a facial surface, and it's charted as an F. And that is it for the basic teeth nomenclature. I hope this helps, and you can use it on your daily tasks to have better communication with your team members. And we'll give you some exercises for practicing so that you can get proficient at naming and understanding where the teeth are and what their numbers and names are. And we'll see you on the next video.